Okay, I'm quite excited to be here. So thanks a lot for for accommodating the technical gymnastics we are trying to do to actually do this. So I'm actually calling and speaking on behalf of the Provincial eHealth Viewer and what it is, why you care, why you think it'd be beneficial, and the benefits we actually have of actually having it accessible from EMRs. So it's not a convoluted process for you to get access to the data, because we know that workflow is the paramount consideration when actually getting access to new tools. So we think that we've actually come up with a very good integration, which actually minimizes a lot of barriers. So my second slide, just a land acknowledgement that I'm actually thrilled to be actually playing on the Musqueam, Squamish, and Tsleil-Waututh territories. Despite the ability to actually have this opportunity. So what is CareConnect? And I heard a little feedback there. So I understand from the attendee list, which I received, some of you already have CareConnect. So some of them, but the vast majority actually do not. So for those who actually do and already have it, maybe you can have a little rest here, and then we can actually bring your comments back in when we start talking about the value and the benefits. We can get your feedback there. So what is CareConnect? So CareConnect is our BC Provincial eHealth Viewer. It is a read-only electronic health record, which amalgamates a significant amount of data within the health authority system. We haven't yet reached out into private practice and private clinics, but from a health authority perspective, a lot of data which the health authority actually has custodianship of within their systems, we actually make available through CareConnect. And the reason why I'm actually bringing it forward to you today is because CareConnect is now available outside the health authority. For the first 10 odd years that CareConnect has been around, it's been a health authority centric solution. So think emergency departments. I'm down in Vancouver. I go skiing up in Kelowna, break my leg, go into the emergency. Kelowna General has no idea who Oliver Thompson is. So this is an opportunity for the emergency department to go on. Okay, great. Oh, there's lots of information on Oliver Thompson within Vancouver Coastal Health. It gives them an opportunity to actually at least get a head start on some of my medical conditions. This is the most important slide to look at. So I hope it actually comes across really well. So this is what data is actually available in here. I have sent the presentation off before the conference, so you will have a quick access to getting this slide. This is I guess the key one. Horizontally, so the rows here are all the sources of the data coming through. So it's mainly health authorities, but we do actually have some private practice down the bottom. So from a lab perspective, Accelerus and Valley Medical out in the Valley, and then the vertical, so the columns there are all the different data domains. So encounters, hospital encounters. So this is all the information that from a hospital when someone was admitted and discharged. In some organizations, it actually even includes outpatient clinics whenever they've been admitted in there, discharged, and some community-based encounters from a health authority community services perspective, say mental health. So they will actually we have a complete set except for interior health, which we are nearing completion on bringing them on, so you can get a full picture of where they've actually been. Labs, 99.9% of the labs that are in the province. So if you ever get in a situation where I don't have the lab result, I should have the lab result, where is the lab result? Pretty guaranteed that lab result will be available within CareConnect. There's a few very small specific specialty labs which aren't connected, but highly specialized, which for the general population doesn't impact. Imaging, if there was imaging work done within the health authorities, so this is a positive on the imaging side, but the negative here is we do not actually have the private imaging labs in here. So any MRIs or CTs that are actually done outside the health authority, we don't have that information. However, anything that does happen within the health authority, the reports are actually available there. Documents vary by health authority, depending on where you are. I know Vancouver Coastal Health sends a considerable amount of documents, which are available within CareConnect. Interior Health, a much smaller subset. So this is depending on where you actually practice. If you're in the Lower Mainland, between VCH and Fraser, there's a significant amount of content in there. Everything from discharge summaries to surgical reports to outpatient clinic reports and the like. Community documents. This is really named from a health authority perspective. So a health authority community services. So home care visits, mental health, so the public health programs which they offer. So those type of documents which are actually provided, as opposed to community-based physicians like yourselves actually having content from there. We do actually have some content from the virtual physicians which supports HealthLink and 811. So if a patient calls up 811, gets referred to a virtual physician to have a consult, that consult will actually appear within CareConnect. Immunizations, if it's within the public health system, we will have the immunizations presented within the CareConnect. Immunizations which tend not to show up are ones that are actually captured within private practice. So maybe immunizations that you provide, that's like for children, for example, if there's the young immunization you give for a young child, at the time they go to school, those records are then submitted to public health. Public health actually enters them in, and it's actually accessible in there. Any immunizations given via pharmacists out in the community, those will actually all flow through to CareConnect. And then registration information. And the last one, registration, the value there is seeing members of the care team. So typically when they're admitted into the hospital, there's a list of physicians that are actually involved in their care. So that's actually available to review. And then medications, quick access to PharmaNet. So I'll pause here to see if anyone has any questions on content, because this is the most important part.
Dan? Excellent question. Stan, Dr. Rose asks, how does CareConnect register the MRP, the family physician?
So I'll premise this by CareConnect is an amalgamation of a vast variety of different systems. So we basically collect what is given to us, and we try and influence what is actually sent to us and trying to be sent to us in a standard way. But at the end of the day, we get what we get. So the MRP, the process of actually displaying that within CareConnect comes from the hospital system upon admission. So patient walks into the hospital, hello, I'm here for whatever. And the admin staff at registration ask, who is your MRP? And they say it's so-and-so, or they don't say, or they say it's a clinic, or they say it's is a physician, and sometimes they get it wrong. So that's what they actually record in their system. It has actually, so that would be one experience from one hospital. You'd have another experience from a different hospital. So CareConnect actually presents a number of different physicians that are involved in the care team. And the source is coming from the hospital there. That
part B to that question, that's simply if we know we are the MRP and it's listed as no provider, how do we correct that?
So CareConnect, again, being a view-only system, the way to correct that is at the source, so the source system. So it's actually finding out where the source of the data that CareConnect got, so we know, and then actually for us following up and actually having someone within health information management actually go and do that correction. So the simplest process is to contact CareConnect to say, hey, I'm the MRP for this patient. Why isn't it recorded there? And then we can actually do the heavy lifting to find out where, when, what, and actually make that change within the source system, which is then presented within CareConnect.
Okay. There was a second question.
Well, and actually, sorry, just to elaborate on the first one, the Ministry of Health has launched the LFP programs, the longitudinal family physician program, which is it was based on rostering, the rostering principles, through which they actually hope to gather the MRP for patients. So at some point, when that process actually gets robust enough, so we can rely on it for actually knowing who exactly the MRP is for a patient, then CareConnect will just be another consumer of that to actually go and not rely on the hospital systems, but actually rely on that rostering system. I believe that implementation is scheduled for this year. So, maybe within the next 9 to 12 months, we'll actually have a better source of MRP data.
Not to belabor the point, but it's critical because patients are moving about, physicians are retiring, and sometimes when we need information on patients who've been with us for some time, it doesn't get to us.
Yes, exactly. Yep.
All right, second question. Another excellent question. The question was with 811 providing virtual care. How is that information captured, if at all, in CareConnect?
So what we do is, so the process for 811, patient calls up, talks with a nurse. Nurse thinks, you would benefit from a consultation right now. And then there's a process to actually get a virtual physician to actually arrange a consult relatively quickly, either then or definitely within the next few minutes, hour. So that documentation is actually stored captured within an EMR called MOIS. So Bright Health MOIS. So upon completion of that consultation, there is a process to gather that, package it up into basically an encounter summary, and actually have that sent through to CareConnect. So I believe the process probably it should be instantaneous, but definitely within a few minutes post that encounter of it being finalized by the physician, it will actually be available within CareConnect.
You had a follow-up?
I guess my question is if they were the nurse triage them to a dietitian. I know that the dietitians or pharmacists will call patients for consultations too. Are those also uploaded? If they had a specific consult with
So basically, the question is, if it's not a physician providing consultation, it's another provider, dietitian, social worker, or otherwise a nurse. How is that documented? And will that show up in CareConnect?
I do not know. I do not know how it's documented, but I do know that it was not shared with CareConnect. CareConnect, we only actually have physician encounters from that service. However, if you want to get me specific examples of services, Anna, then I can actually inquire with that and actually find out what it looks like, find out where it goes, and find out if there's any plans to actually have that information sent to us.
I want to speak for all in the room, but I think the sentiment is that any advice given to our patients, I think as an MRP, we should know about it so that we're prepared.
Yes. So there's two parts of that. One is confirming the MRP and making sure that we do that right. And again, I believe that the LFP program has the goals to do that. And then the second part of it is we fully acknowledge that CareConnect is not the most optimal way for you as the MRP to get the content. If we know who the MRP is, we should be sending it to you and actually sending it right to your EMR so that you can consume there. So there are really two parts to that question. So that if you do find out any sources that aren't coming to you, I would tackle it that way. Who's documented it? Where's it going? How do we get it to the MRP directly? And then if not, failing that, if there isn't one, let's say it's an unattached patient, failing that, then CareConnect's a good place to put it so that, for a variety of providers can get access to it.
Thank you. More questions? So I just want to get a sense for who in the room actually has CareConnect. I see about half a dozen hands. Who wants to get CareConnect? I don't see any hands. So everyone who has one.
Oh.
Yeah, who wants to get it, who is in the process? Dr. Canada's question.
I just wonder if this viewer idea is there any plan for expand it into a full integrated, system with EMR? Given that you're successful with EHR, the hospital type system, is reasonable.
So,
all of these things directly.
Did you hear that?
Nope.
Oliver?
No.
Sorry,
If you can repeat,
please.
please.
Given that it's a viewer only right now, read only, is there any plans in the future to make it bi-directional and have it automatically come into our EMRs?
I will say there are plans, yes. And is CareConnect part of those plans? Yes. Are we close to achieving that in the near term, the next year or two? Probably unlikely. So right now the focus is on making the data easily accessible. So the complexity of just gathering up the data and actually making it available within one viewer. And then the second part that we're actually working on, the Provincial Health is working on, is how do you actually put together? Forgive the tech talk here. How do you create a series of APIs, these front doors, so that other clinical systems can go in and actually grab the information that they want? So that's work that we're doing right now. Create those front doors, and then the second part of it is then to connect with the EMR vendors, the OSCAR community, to say, hey, there are some front doors here that are available for you. Once we figure out the physician identity side, when we actually sign on and confirm that it's exactly you, because private security is it's a paramount importance here. And that is actually having that functionality built in the EMR to go and grab the data, pull the data, and have it bright within your record. So there's those two parts. There's our part to build the doors to allow the data to be to ask the question and give out the data, and then the second part is the EMR side to actually knock on that door and actually pull the data into their system.
So Oliver, we have about 4 minutes, I believe, right? No? Oh, it's the way the mic is set up. Oliver asked me to participate in that. I can show you sort of a semi-live demonstration of what CareConnect is, but it seems like that many of you already have partaken in it. But I want to add a comment to what was just asked, and that is be careful what you wish for. It is possible to get all this information into your EMR. At one time, Herb and I participated in the iMiTS project started at least 10 years ago, where we recognize that there are massive databases that have valuable information, and we want to have accessible easily to us. And it was an all or nothing, so we chose nothing. So now we can pick and choose, and just, if all of it is available to us, just think about what your inbox will look like. So I'm going to just, sorry, Oliver, if I burst your balloon or whatever.
No, that's fine.
So within OSCAR, at least, and I disclose I use the WELL version, WELL created a CareConnect button, and it's up here in the first row, up at the top here, where you see the name, birthday, main phone number next to the appointment, and here's CareConnect. It wasn't always there. The original location was, oops, I got logged out, buried. Let's see, I can log back in. Okay, here's the one. The original location was one menu down and down there. It's pretty obvious that nobody will find it. Stan, who's great creating Grease Monkey, his Grease Monkey was adapted, so it was actually down here. You can see a PharmaCare button, which isn't yet part of OSCAR, but maybe will be soon. So how does it work? If you haven't done this already, you click on it. You need your BCID card set up on your phone. This will not go anywhere fast because this is a pretend patient without a valid EMR, PHN. But once you log in, as you know, you stay logged in for an hour or so. There's no log out. It just automatically kicks you out. So it's an invalid health number. But what can you see? Well, you see, let me see. On the left-hand side, these are the main things that were described. This will be the demographics. I blurred things out. This would be probably hospital visits of sort. Here's your beaker, chemistry beaker. So it's your labs, all of life labs and the hospital labs, not just emergency, but everything that's done while they're admitted. This is imaging, but again, only health authority imaging. There's your pharmanet access, which is now the same price as CareConnect. Free. Yes, and the college really encourages you to do so, and they're offering seminars on how to get signed up. Believe me, it's not an easy process, even for a tech geek like myself. It took me 6 months, and the whole clinic had to participate. So it is quite the hurdle. I don't know why it has to be so, but tap your DTO rep and have somebody hold your hand and lead you through that. It's worth the effort. Here's your community documents. A lot of it is not that helpful, unfortunately. There's a lot of Paris stuff, home health stuff that says we visited you, and that's it. This is very helpful. This is a panorama. The needle is your vaccination, and indeed all your childhood vaccines are in there. The ones you do for adults, tetanus, won't be in there because you don't submit that. You do submit a sheet documenting which childhood vaccines you give so they can replenish your supply. That data gets input. Now, it could be a lot easier. It could be, digital. It could be, bi-directional. And I think it was to be here. It is potentially in Ontario. This last one, I'm not sure what it is. I rarely use it. Other content. Okay, great. So here's what the labs might look like. And you can see that there's those usual all-encompassing labels. You don't really know what's in chemistry panel. There's a red flag that something is abnormal. They do pick out certain things, A1Cs, INRs. This is a surgical report, probably a pathology report, and so on and so forth. So you do need to poke into each one and then back out. It's rather slow. It downloads as a PDF. In your agreement, you're not supposed to upload this. If you read the fine print, you're not, so you're supposed to memorize it, I think. And the reason for that is if somebody changes, if the source changes the report, they can't guarantee that your version is the accurate version. But, you do what's sensible. I don't memorize it. Print it as a PDF and upload it. It's extra work. This is a PharmaNet profile. It's probably different from your Accelerus or MediNet. It's still got the limit of 14 months worth. It's awkward. I printed to a PDF because it's a little more visibly pleasing and readable. But I don't know what I would do without this now. I access it probably every third patient, at least 5 times a day, if not more. And I bring on new patients to my nursing home. Without this, PharmaNet, and without the CareConnect hospital data, I'm lost. So this is very, very powerful. What doesn't it have? It doesn't have a patient health record. There's no core data set. If you believe what the allergies are here, okay. But it doesn't tell you this person had their appendix out, prostate cancer or anything like that. You can suspect it from some of the data, but you don't know it. So there's a lot more that can be done. It needs to be a lot faster. It is integrated insofar as you can click on it and get to the portal with your patient's data. And then it's like, looking for that needle in a haystack sometimes. Dr. Chang. No, it doesn't. So originally, we were asked to try out UCI, which is your Fraser Health project. What is UCI? It's a subset of CareConnect. They just wanted to be, doing their own thing, and it needed a VPN, so we declined. So CareConnect does not require a VPN. We are not hosted on the cloud. We have our server on site. They would know that. Dennis Warren. Oliver, you still there?
Yep. I'm here. You're doing a great job.
What's the difference between PPN and rapid access?
Is that a question for me or?
It's a question for you, Oliver.
Okay, so the PPN, the Physicians Private Network, it was a private network established a number of years ago during the PETO days, 2005, 2007, to facilitate secure access to cloud-based EMRs. The initial launch of CareConnect required use of the PPN from a security perspective. We have since overcome that. So we actually do not need to actually use the PPN to get access to it. So from a clinic perspective, our preferred deployment is deploying it via the internet and not via the PPN. So that's connectivity, how you within your practice or wherever you are get access to CareConnect. The rapid access button, that button, when it's configured, knows which way to go. So it knows, do I go via the PPN on-ramp or do I go via the internet on-ramp? I believe for Oscar, I think most of them, if not all of them, are actually configured for going via the internet.
And other questions? is it accessible out of province? Oh, Oliver?
I believe so. Yes, that's a very good question. I can take that away. I don't believe we actually have any restrictions to say that we can't. Actually, sorry. You know what? So no, I know the answer to that. Out of province, absolutely yes, not a problem. Out of the country, I believe there actually are some firewall restrictions which actually prevent that. However, I would need to verify that. So out of province, not a problem. Out of country, I can clarify and get back to you.
Dr. Hurwitz, you're not going to do work when you're on holidays?
Well,
Vacation?
okay, so maybe I won't answer that question. No, you can't get access out of country.
So, Dennis. So Dennis wants to confirm, so you don't necessarily need PPN to get CareConnect access?
You do not need, and we prefer that you do not have.
That's refreshing. Thank you. Where do physicians sign up for rapid access CareConnect?
So, so there's two parts to that. Oh, I can go back to sharing my screen now. Who uses? Just so you know, we are deploying to everybody and everywhere. That's accessing it. Next steps. Okay, yes. So within this slide, there are two ways to actually get access to CareConnect. The button within your EMR is actually the last step. One is getting you access. So Dr. Yap actually mentioned that it took him a long time to get access to it. I think he was one of the first people that went through our long, convoluted process. But just for context, the original process was you must become familiar with the eHealth Act, and we're like, no, physicians will not do that. That's crazy. So we've actually streamlined our process. We've actually done improvements to our enrollment portal, which actually makes it a lot easier to get access. So there was the initial launch of CareConnect, which is like, oh, this is crazy. We acknowledge that cumbersome process. We've made it a lot easier since then. And now we offer two ways. Individually, there's a link to our website on the PHSA website, which walks you through the process. If you want to do that way, or we do actually support group enrollments. So if your clinic, if there's a number of physicians in your clinic, physicians, MOAs, any nurses that come in, we can actually come in and actually facilitate a group session and just walk everybody through it. It's streamlined, it's fast, it gets you guys up and running very quickly.
So Dr. Hurwitz was saying after a lot of frustration, he had to personally email his GP ID from Prime to CareConnect to get things rolling.
Okay, so the elephant in the room is PharmaNet. So think of us, for CareConnect, our goal is to make it as seamless and streamlined as possible for the end user, for yourselves, and we've been able to amalgamate all of the data under one sort of agreement, one enrollment process, with the exception of PharmaNet. PharmaNet, because they actually have special legislation in the province of BC, they feel compelled to uphold their own legal agreements, their own registration process, their own everything. So despite our valiant efforts, including senior leadership, legal counsel at VCH and PHSA, to basically go and try and amalgamate the two, again, one registration process, one legal agreement, we've not been successful there. So I believe we actually have made some success in that. Previously, we weren't even allowed to talk to Prime about your enrollment. So you'd enroll within PharmaNet. I think you were enrolled via a system called Prime. Prime would talk to you only, not us. So I think we've broken that barrier a little bit, so that now we actually get privy access to the fact of, well, you don't need to email us because we actually get access now. So marginal improvements. It's still not great, but yeah, at least we're going in the right direction.
And I've been told that some of this information is actually posted on the OSCARBC website. Oh, this presentation is, sorry, so you can get references there. Gunter. is there a policy, what is the policy for medical trainees accessing CareConnect from community clinics?
Medical trainees. Can you sort of define that? Are these actually students or are these residents?
Residents. So they're MDs and they're training with
Yep.
us.
Yep. Not a problem. Not a problem. I would just need to confirm there's two things. For certain providers, physicians definitely, nurse practitioners definitely, and I believe we just did that for nurses also. They can basically self-authorize themselves. You know what? As long as you confirm you're in good standing with your college, fantastic, you get access, not a problem. My assumption that also applies to residents right away. If not, the second aspect is anybody in your clinic who you authorize in order to support your workflow. Again, our focus is on giving you the best workflow. Anybody you authorize can actually get access under your agreement. So if that residence is actually working in your practice under yourself, great, not a problem. That's not an issue at all. So, but what I will do is I can take away to confirm if residents themselves can go get their own access under their own medical license. I think they can, but I'll confirm.
Yeah, I can confirm that trainees hospital will access CareConnect for their hospital patients, and some of them are quite reluctant reading all the fine print to do the same when they're in our office. Dr. Chan.
We have very similar clinical connect in Southern Ontario. I don't know if it's a problem here, but when you have different data sources from different hospitals, depending on what that copy they send to you, the viewer does not attempt to make it easier format for you to copy and paste your note. Sometimes it's easier, what the consultant said. Copy and paste, what the consultant said. But the new ones like FA and Cerner and they use very extensive HTML, very lots of little web. When you copy it, it just doesn't mean. No. You have to kind of print it out at PDF and now upload it. It's just more work. I wonder if you encounter that problem.
So in Hamilton area, they have a similar system called Clinic Connect, and it is a viewer, but the different hospitals have different formats, some of which are more amenable to copy and paste, and others have to be printed to PDF. Do we have that problem here?
No. All of the actual documentation that comes in from a document perspective is all PDF based. So she grabbing the content from there, grabbing the PDF itself, even though I can't support that. That should not be a problem.
And actually I knew the answer to that. So everything has to be printed to PDF. Nothing is like, copy and Control A and then Control V to paste. Everything has to be printed PDF, some of which are digital and some of which are kind of image, analog to PDF.
Yeah.
All right. I think that's a wrap. Any final comments, Oliver?
No. Just again, if there's any, for those of you who are using CareConnect, if there's any comments on what you could do or what we could do to actually make it better, again, we're just striving to make your lives a lot easier. Please send them my way. If there's anyone in the room who is interested in learning more or getting access within the presentation, again, I'll just, if you can still see my screen. Do it by yourself or do it with your group. We are also working with divisions of family practice to actually support group enrollments. So whatever we can do to actually give you guys access. So, and any other questions, just feel free to give myself an email.
Thank you, Oliver.
Okay. Well, thank you. Thanks for having me.